The Mammography Quality Standards Act updates remind us that every mammogram report must contain one overall final assessment of findings. Hello, it's Rick, and I'd like to invite you to join me in this mini moment about the final assessment of the findings category identified in Section 900.12, Paragraph C, Subparagraph 1, Subparagraph 4, Item A, negative. According to MQSA regulation, when selected, this assessment must appear in the test results report as negative. It is defined as nothing to comment upon. If the interpreting physician is aware of clinical findings or symptoms despite the negative assessment, these shall be explained. It should not be lost in all of this conversation that the American College of Radiology also has a report organization called the Breast Imaging Reporting and Data System. So, there is a BI-RADS Category 1, negative, defined as a normal examination with nothing to comment on in that system, along with other BI-RADS categories. In the real world, where your breast imaging practice operates, it is not unusual for interpreting physicians to use this ACR system to include multiple BI-RADS category assessments into a single report of test results when a bilateral study is performed based on the breast imaging findings of each individual breast. However, please note, the FDA's Mammography Quality Standards Act states that all breast imaging practices are required to comply with this guidance when reporting mammogram results. Overall final assessment of findings classified in one of the following categories. The assessment statement is only the word or phrase within the quotation marks. This refers to incorporating a single overall final imaging assessment for the mammogram using one of the categories provided in MQSA's lexicon and the specific wording provided in the regulations when reporting the assessment selected. This overall final assessment of negative is pivotal in any breast imaging practice. First, a negative assessment provides reassurance to patients, significantly reducing anxiety and promoting a sense of well-being. For healthcare providers, an overall final assessment of negative simplifies clinical decision-making so physicians can confidently focus on other aspects of patient care, streamlining the overall care process. A third outcome is that patients with this overall final assessment do not require further imaging or biopsies, conserving resources for those who need more intensive diagnostic procedures. Finally, standardizing terminology like negative ensures consistency in mammographic reporting across various healthcare facilities and clear communications among radiologists, referring physicians, and other healthcare providers. Interestingly, during the review process, a number of regulatory comments and responses were made about the negative assessment. A key point raised in the final updated regulations is the distinction between the required assessment statement and the explanatory language. The term negative is mandatory, while additional explanations provided in the regulations are for clarity but are not required in the report. This approach aims to standardize assessment categories while allowing flexibility in the report's narrative. Thus, if the interpreting physician is aware of any clinical findings or symptoms, these get documented even if the mammogram is categorized as negative, ensuring that all relevant clinical information is considered and recorded. Another observation was the distinction between negative and benign assessments. The FDA maintains the negative and benign assessments should remain separate, despite suggestions that they be combined due to their similar clinical management. Separation helps identify benign findings explicitly when they are present. By understanding this assessment category's role in the MQSA lexicon of overall final assessments available to select from and its implications, healthcare providers can make informed decisions and effectively communicate with patients, ultimately improving the quality of care in breast imaging. If you like this, please give it a like. Also, make sure to subscribe for more bite-sized information about other mini moments. Do you have an opinion or idea about something you want to hear about? Be sure to leave us a comment. To get references to the information used here, check out the link to our Knowledge Hub below. Until next time, continue striving to enhance patient outcomes by delivering compassionate and precise breast imaging care.